Welcome to the 2024 Senior Care Summit. We are your hosts, Pam Dunwald and Linda Criticus with Your Nurse Advocates Consulting. We are nurse advocates working with aging adults as well as their families. So really excited to bring you 28 topics along with 28 speakers that are going to share their area of expertise in helping you care for your aging loved one. You know, we have speakers from 9 different states, but each video is going to give you information that you're going to be able to use no matter where you live. And as a matter of fact, some of the speakers have nationwide services or virtual services that can help you no matter where you are as well. We're going to have many healthcare professionals. It's going to include doctors, nurses, nurse practitioners, pharmacists, and a lot of other speakers in the healthcare field. And we just want to make sure as we're sharing the videos that we want to stress that these summit videos are here to provide education, and we're not here to diagnose or treat any medical condition. So if anything comes up through any of the videos that you have questions of, please seek out your healthcare provider to go over the information with you. If you haven't purchased your VIP ticket for the summit yet, we encourage you to think about a few things. Number one, many of us have been to, senior fairs or presentations where we've been live and in person. And those are really nice and they're very informative. And I don't want to take anything away from those, but unless you're really good at taking notes, oftentimes when you go home, you forget about some of the information that was shared. So with our VIP access, not only do you have access to all 28 videos, but you have unlimited access so that you'll be able to go back and review those videos again and maybe pick up something that you've missed the first time around. Second thing is, as caregivers of aging parents or loved ones, there might be a video that you think is really important that you would like to share with your loved ones. So again, you'll have access to be able to go back and set up a convenient day or time that works best with you or your family member, and then to be able to review the videos that you think that would be very valuable for them to view with you as well. And then you can, discuss it and talk through questions. Last thing is, as a VIP ticket holder, you get unlimited access to all 28 speakers. Our free access is going to be limited to our summit highlights videos, and that's going to be approximately half of the videos. So in order to take advantage of all 28 speakers, then you really want to maybe consider getting that VIP ticket. And that is registration is going to start beginning on February 1st. As nurse advocates, one of our specialties is to identify resources for you and your family. And so right now, I'd like to take the opportunity to introduce you to my partner, your second nurse advocate, and Linda Criticus, and she's going to tell you a little bit more about us and what we do. So Linda, could you please share a bit of information on what patient advocacy is and what we do as nurse advocates?
Thank you, Pam. Advocacy is a new and upcoming kind of some people would call it a buzzword, but it truly has a very deep meaning. Being an advocate for someone means that you are there for them, that you are looking out for their best interest. As a nurse advocate, that gives you kind of an extra bar or an extra positive component to advocacy. The nursing part of it allows us to be able to look at things both from what is right for you as the client, but also from a medical or healthcare perspective. As advocates, we never, ever make the decision for you, but we kind of translate the noise. Because a lot of times the information that's given to you as an individual in the healthcare system is confusing. It's downright, sometimes intimidating. We sort through all that. We translate that into a way that you can understand and in a format that you can then take with you to help you make informed decisions. Our nurse advocate consulting business is just that. We actually take all of those components from being a nurse, and between Pam and I, it may sound like we're really old, but we have about 80 years of nursing experience and very diverse skill sets. And we take that expertise and we bring that to you in a format and in a way that you can utilize to provide and make the best decisions for your healthcare. We don't want to take that away from you. And today's healthcare system being as complex as it is, it's really hard to make informed decisions. A lot of times you're not sure, am I making the right decision? What do they mean by that? What does that diagnosis mean? What is that treatment option? What do you mean I need a different level of care? Or what do you mean that my mom needs a different place to live? What are the safety issues I should be aware of? These are the things that being a nurse advocate allows us to do because we have that level of expertise being nurses to be able to take those things and put that into a plan for you to help you make the decisions that are right for you. We never take that away from you. And because we're independent, we're not tied to any hospital system, insurance company, or clinic, or group, or of any kind. We are truly independent, which allows us to be truly in your corner to help you make the most informed decisions for your care.
Thank you, Linda. And just to wrap up our welcome video for you, sometimes it's easiest to explain what we do by just with a quick story. So just going to share just a very, very quick story with a client that we recently had. She went to the Aging and Disability Resource Center. Her husband has Alzheimer's. He's weak. He can no longer leave the home. He doesn't qualify for hospice yet, but now she's homebound because just by default, because she can't get him out of the house anymore. She wanted him to get a flu shot. She couldn't get him in to see the doctor anymore, and she was concerned about that. She couldn't get out and go grocery shopping or go out to lunch with her sister because she couldn't leave him, and she really felt stuck. So when she went to the Aging and Disability Resource Center, they were over assets and what they had. They couldn't help them, and she was actually handed a booklet and said, go home and make phone calls. Well, fortunately, she called us and she gave me the scenario and she says, can you please help me? And she just sounded so desperate and so frustrated. And so we were able to put palliative care in place, which is a nurse practitioner comes in for someone who has chronic disease. We're not going to go into that now, but we got the doctor component handled. So a nurse practitioner from palliative care came in. We called the health department. The nurse was able to come out and give him a flu shot. So now we got the flu shot, the doctor taken care of. We got a non-medical home care company to come in that had a man that would sit with them and visit with them so she could get out. And we also found adult daycare when she wanted to be away for longer periods of time. So we put the plan in place, and then they stayed with us for a couple of months on our monthly kind of our maintenance plan. And then when palliative care was fully involved in taking over, then we exited the case. So this is a great I guess, example of some of the things that we can do as advocates. So, Linda, I want to say thank you for sharing what we do. We're very passionate about that. And we're going to see you back here soon, with our videos and our topics. And we're going to cover the 5 different areas of need. So please remember, complete the evaluation forms so we can be sure that we're making improvements and we're addressing your concerns and your suggestions. So welcome to the Senior Care Summit 2024.